This is a 28-year-old female who comes in with concerns related to her facial aesthetics, her jaw position, breathing trouble, snoring, sleep apnea. Here on frontal view, you can see on this smiling picture that she's got a bit of a gummy smile. She shows more gingiva on the right than she does on the left. There's a slight cant of the upper jaw as well. She shows a bit of lower teeth. You can see the midlines are off, and you can already begin to assess that she has excess overjet. Here on lateral view, that really shows the morphology where she's got a bit of a prominent nose and she has convexity to her profile. So the most prominent part is the nose, and then it really circles back. In particular, the lower jaw is back. You can see she has this deep labiomental crease because the mandible is back far and the lower lip starts to roll out. This creates some mentalis strain and poor support, and for such a young person, she's already has some marionette lines as well as these nasolabial folds, poor support to the upper lip, some under eye hollowing as well, which in some of these snoring sleep apnea patients is multifactorial. Here's the opposite side. Again, convexity, retrusive mandible, prominent rolled out lower lip. The occlusal photos show a bit of that midline discrepancy that we saw and talked about, and some excess overjet. So this means that this is a class 2 canine relationship, class 2 molar type relationship in usual circumstances. She does have a premolar that's been extracted that changes that some, but the mandible's small, her maxilla is long with a gummy smile, some vertical maxillary excess. So here you can see both her lateral ceph where there's excess overjet, some of the midline discrepancy here, presence of third molar that's impacted, a third molar that's not being used, third molar not being used, and a partial impacted third molar here too that we will need to address. Typically people would do this before surgery, but we've written a paper that shows there's no increased complications or time of surgery if you do it at the same time. Here's her preoperative digitized CT scan. Again, appreciate the overjet. Again, some of the midline discrepancy. Here we begin digitizing, changing the colors. Here you see that overjet, the overjet there, and a bit of a steep occlusal plane that we can really take advantage of by flattening this to really open up the airway. And this will help aesthetically and mean we don't need to bring the upper portion of the maxilla as far forward as we do the pagonion. So here shows mandible first, though we always plan maxilla first. The advantage of some of these 3D tools, we know exactly where the nerve is, so when we're making our sagittal split, we can avoid the tooth root, we can avoid the nerve, split this out of the way to ensure that the sensation, and as the nerve exits as the mental foramen, that we can do our best to optimize lip and chin sensation post-operatively. Now you can see post-operatively, this was something of the plan where we set it almost with edge to edge but much less overjet. Here this isn't showing the genio, but we've actually done the genioplasty too to come down and forward a bit, and this is her actual scan, her actual post-op that really lies very similar to the plan as it should. There's a little bit of opening of the bite here, which sometimes you see with these class 2 mandibular retrognathia where there's a bit of a tripod, so there's contact here, there's contact in the anterior 6 teeth, but sometimes in the premolar region there's an opening that the orthodontist will close. This is the plate fixation that you saw. Intraoperatively, and some bone grafting is placed here so that there's no step off and to optimize the healing. Importantly, especially in a case like this, you can see the posterior airway space is quite small preoperatively, which happens with a small mandible. And when you bring this forward, it pulls the tongue in this direction as well as the chin, and this is opened up quite a bit, so her breathing is better. And when we go back to do her nose, it'll be even better and icing on the cake. Here's the opposite side, and these red lines again are the airway space. Look how much huger they are compared to preoperatively. Frontal view, better symmetry. Traditional view, right lateral. Excellent profile and soft tissue that you can see there. And then the 3D shows now her lips close more evenly. She has better projection of her mandible and chin. Her nose looks a little bit better just from orthognathic, but it'll look better still when we do rhinoplasty. Here's the opposite side. Much improved, better E-line, S-plane as well. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com. Thanks again.